Management of jaw pain and clicking.
When the patient says that the jaw is hurting, what most of the time they mean is actually the muscles are hurting. If you don't have a trauma or fracture, the bone can very rarely hurt. It actually hurts the surrounded tissue, which are muscles, periodontium. So in this way, it's very important to understand why the muscle hurts. I can give this analogy as doing the exercise in the gym. Like you get really motivated, you start working out every day, maybe 2-3 times a day, and then in the second or the third day your muscles start to hurt. And the muscles start to hurt because of the hyperfunction that they did, and actually in a more deeper way they hurt because inside in the muscle accumulates a lot of products of the metabolism of those muscles. And what happens with the chewing muscles? It's the same. If you have misaligned bite and your teeth are touching only 1 or 2 contacts, actually the chewing muscles are trying to balance this bite and they're overworking, trying to have this steady position, which is most of the time impossible. Also, when your jaw is in a different, not biological position, like for example too backwards or too forward, the muscles are too extended, and of course they work more to do their normal function, and in this way, because of the extension and because of overloading, they hurt. So this is very important to understand, that the precise teeth contact, the precise restoration and very good bite that we can have after any treatment is mandatory. Otherwise, we will have some functional problems, as what I explained. What is the clicking? The clicking in the joint is actually this connection between the cartilage, this jelly structure between the two bony structure in the joint. And when this cartilage or this jelly is not on the right place, while we are opening, this jelly goes left, right, forward and backward, or go back to the initial position. And this repositioning of this jelly is actually happening to the sound of clicking. The very important thing is that during the years, this clicking the noise start to reduce and start to be smaller and smaller and smaller. And this way we will see that we will hear less clicking. For the patients, this can be a signal that actually the problem disappear, but it's on the contrary. This disc and this jelly start to get thinner and thinner and thinner, and this in the future will be a big problem for opening and for a lot of problems. Beside muscles, actually the joint, the temporomandibular joints, can hurt also because it's actually contain 40% of innervation of proprioception in the whole body. So we have 7% and 7% of the whole innervation of the body located in each joint. So this is very important, that when the condyle or the head of the mandible is not in the right position, it can create trauma to the surrounding tissue, which are very innervated. So by this trauma, what we will feel, it's a big pain in these regions. Also, it's not impossible to have a vertigo, or to have a ear noise, or to have some kind of pain in the head or in the neck because of that. So how we can prevent? It's very important to do the correct treatment of the bite with a good specialist. Also, to check at least 2 times a year our contacts in the teeth, or when we have some changes, we to know why these changes are happening, and of course to have a very precise restoration in our teeth.